Exactly where do we stand right now?
Yeah, I think that's a great question. And I think at the end of the day, we've been saying from the beginning of this virus that the fatality rate is probably between 0.5 and 1%. Early on, it looked like it was much worse, partially because we weren't testing enough people. So we had no idea really how many cases were out there. We have much better idea now. At more than 100,000 a day, which is incredibly concerning. Back in June, Dr. Fauci said, if we don't change behavior, we could reach a point this fall where we have 100,000 a day. Now that seems like the goal to try to reach rather than what the threat is at this point, because we're just blowing through those numbers. Now we may get to a point where we have 100,000 hospitalizations a day. So for me, I'm incredibly concerned with where things are. I think the vaccine news is extremely encouraging. But it's important to remember that's not something that's going to solve the problem in a day, a week, a month, or even a few months from now. We have this crisis now in the United States we have to address, or lockdowns are coming.
But it does, Anna, it gives us the one thing that is maybe the most important thing, and that is some hope. A window where we can tell our kids, I could tell my teenage daughter, we're probably looking at spring of next year before we kind of get, but we are seeing the other side of this.
Yes, absolutely. So we have the pandemic. I think Chris eloquently talked about the resurgence, but I think the base case as far as investors go is at least the Pfizer vaccine, perhaps others, will be widely distributed in the second half of 2021. And that would mean we have deferred utilization in the inpatient setting likely picking up. The stay-at-home stocks have seen a rotation out, not just more broadly, but also in healthcare toward a few more of the reopening stocks like hospitals, but most importantly, a little bit on the device companies as well. On the other side, though, as you think about the investment landscape in healthcare, you have to also contemplate against the backdrop of this pandemic, the election results and the SCOTUS hearing on November 10th of the Affordable Care Act. Most likely now we will have President Biden sworn in January. We have divided government, which means no public option. That did lead to a pretty nice rally in the healthcare stocks. And the SCOTUS hearings, I think, were pretty clear that Justice Kavanaugh and Chief Justice Roberts would support the law, even if the mandate was declared unconstitutional. So, you have all of these things put together. I don't think that the Biden administration, in my view, with this pandemic and with the pharma stocks and the pharma companies, really, if you will, coming through at warp speed on a vaccine, and the hospitals seeing a lot of financial and other pressures, we'll see much pain in terms of draconian policy reform.
That November 10th Supreme Court hearing certainly, Chris, is going to be a big one, because we do forget that there are other things longer term aside from the pandemic we need to focus on. It looks like that Obamacare will stand at that November 10th hearing in the Supreme Court as well, at least if Kavanaugh tipping and Roberts tipping off their hats the way we think they are. Aside from the pandemic, what do you think are some of the policy priorities that the Biden administration will have vis-a-vis healthcare?
Yeah, I think Anna's completely right in that the election and the Affordable Care Act case were largely clearing events. I've spent the last 2 years having to respond to people worried about Medicare for all, people worried about a public option, people worried about Democrats getting 53 to 55 Senate seats and the filibuster going away. Now I can say, actually, healthcare compared to the broader S&P is relatively cheap. So come on in. The water's warm. It's a great time to be in healthcare. The Biden administration's likely to obviously, COVID's going to be number one. Number two, we'll be looking for ways to expand coverage through encouraging more people to get into the exchanges, and they'll look for some regulatory action they can take on that front. And then I think we'll continue to see a relatively moderate regulatory agenda where they continue to advance value-based care initiatives, where they continue to encourage people to find lower cost alternatives in some ways. So we shouldn't see the big disruption that people were worried about leading into this, which has really provided relief, and why managed care is up, more than 10% since the beginning of November, and probably has a lot of room to run.
Yeah, and Anna, I think you would agree with that. Looking at some of your research, names like United Health, Humana, they're not sexy, but you think they could be moneymakers, especially under what looks to be a fairly moderate new policy priority group.
Yes, absolutely. I've been a managed care bull for a long time. We've seen a rally. I think the quality names are United, which has a technology platform, as I said the last time, Humana, which is a senior story, a home health platform with telemedicine. These are the GARP names. On the value side in managed care, actually, I think now with the likely reopening in the second half of next year, CVS with the new CEO coming from Aetna becomes an interesting value play. And then Centene, which is a government powerhouse with a nice innovation platform as well. And the ACA being preserved by SCOTUS gives them more room to run. I think it's pretty well priced here.
Yeah, and you look at the global response, Chris, and listen, one thing about this show's Worldwide Exchange. It goes live pretty much to every time zone in the world. And overall, though, the U.S. media is pretty U.S.-centric, which is a bit disappointing at times, but that's the way it is. We look around the world, and everybody's slamming the United States all the time. When I look at your data and Johns Hopkins, let's not forget, this pandemic, Belgium has the highest fatality rate in the world. Italy, the UK, many metrics worse than the United States. Do you see a coordinated global response, or is it kind of going to be all countries for themselves once these vaccines start to roll out?
I think so far we've seen all countries for themselves. I think the Biden administration's commitment to rejoin the World Health Organization, stay in it, continue to advance is positive from a global health pandemic preventing standpoint going forward. But I think the American citizens at this point expect their government to really prioritize vaccines at home. Now, hopefully we get to a point where we have Pfizer, Moderna, we have J&J advancing the ball, AstraZeneca, and others. Do we have multiple vaccine candidates that can then be available globally to meet the need that's out there? My additional hope is that we get to a point where Americans are actually willing to take the vaccine. I think the efficacy rate, at least initially, the implied one out of Pfizer being above 90% will encourage more people to do so. But at the end of the day, we need people to get these vaccines. And I'm a little concerned that the public is still skeptical of that. And I'm increasingly concerned that the virus is going to be.
Shepard Smith here. Thanks for watching CNBC on YouTube.